I will explain about cause, infection, prevention and control measures, washing hands, and wearing PPE. Infection control is reducing the pain from disease transmission and from conditions caused by transmission of microorganisms. Transmission can occur through direct contact with simple through oral fluid and blood. Indirect contact can be through an object confined with the picnic microorganisms with the generic call because intermediates as are not sterile. Purpose of course infection. Number one, the purpose of course infection control is to become referred for help work in the health care environment in plan for efficient control, discipline, recall and forms. As for one example of infection control of a personal procession, commonly as we health works, namely marks, provincial gloves on odor with aims provision transmission, of course in the efficient control. Next, the purpose of course infection control is to prevent or at least record the spread of the disease from pain to health work to the pain to the pain. The treatment room the community including the family of health work in the community to the pain. Next, number three, the purpose of post-infection control in the healthcare facility is to prevent infection transmission to both health workers and patients while healthcare is being carried out and health care facilities are required to prevent health security granulation for both health work and the community serving. Isolation, prevent or infection prevention or control measures developed by the Center and Disease Control (CDC) and should be applied in the hospital and other health services. Isolation prevention are applied to the record and the risks of disease transmission for pain to the pain or a medical work. Isolation profession have two pillars of level, named started profession and profession based on the mode of transmission. A standard patient. Standard patients are patients designed for the cure of all pains in the health care clinics. Standard procedures are applied to body folds such as both saliva and the oral mucosa. Standard procedures include things that must be considered regarding hand hygiene. Before hand hygiene, rings, switches, and all jewelry underwear must be removed. B. Nails must be kept short and clean. C. Do not use nail polish of artificial nails because they can be a part of the bacteria to get ripened and make it difficult to see the drip incident. D. Always are using water. If it is not a default, then one of following options must be used. A. Closed tub bucket. Do bucket and dripper where one person pour water while the other wash the hands. A. Hands must be dried. Adding a paper to our hands dry allow before patting and gloves. 2. Personal privacy equipment healthcare work are required to use the following personal protection equipment. A. PPE. provision of personal privacy, equipment and material for personnel at the must be full and the provision is coordinated with the city or district health office. Patient visit as transmission. Patient visit on transmission are a condition to start pathogens, namely infection, provision or control measures that are taken after to the chip in the infection has been diagnosed. Be indirect contact microorganisms entered the body through contaminated media or inanimate objects carrying pockets of pathogenic microorganisms attaching from both in equipment. And thank you, ma'am.